Good evening and welcome to Your Visual Health. I'm Mike Anthony, and it's nice to have you with us tonight. How much time do you spend thinking about your eyesight? Well, if you're like most people, not very much. In the next 30 minutes, we are going to provide you with valuable information that could save your vision. The program is sponsored by Visual Health and Surgical Center of Lake Worth. They also have a dozen other locations, including Boca Raton, North Palm Beach, Treasure Coast locations, and Okeechobee. These offices make it easier for you to get quality eye care from caring professionals without the travel. For more than a decade, thousands of people just like you have trusted Visual Health and Surgical Center to care for their valuable eyesight. Visual Health and Surgical Center sees itself as a leader in eye care and a valuable contributor to this community, offering no-cost care to those who need it. Part of our community service includes free cataract and glaucoma screenings every Friday afternoon. Consider this program an extension of our commitment to our community. Future programs will highlight issues such as glaucoma and cataracts, plastic and reconstructive surgery. We'll also highlight new advances in eye care, take a look at pediatric eye care and corneal care. Tonight, our focus is on the retina. Also coming up in the show, we'll meet a man who is legally blind, how he fought severe depression to not only help himself, but to help others as well. Tonight, we begin our program with a look at macular degeneration.
How are you doing?
Not too bad. Not too bad.
Good. Your vision is doing very well.
Dr. Randy Katz is an ophthalmologist who specializes in the treatment of retinal and vitreous disorders. The New York-born doctor has only one thing in mind when it comes to treating his patients.
My main goal when I see a patient with macular degeneration is to keep their vision as good as I possibly can and to keep them doing the activities that they want to do.
That activity may include golf or any other outdoor sport you enjoy. It may also, however, include activities that are not strenuous, but are just as important to you. It may include daily activities like reading the morning paper. Macular degeneration is the #1 cause of legal blindness today for people over the age of 60. What's the number one question?
Well, you know, will I go permanently blind? Will I go totally blind? And the answer to that is never. Patients with macular degeneration will never, ever go totally blind. The worst case scenario in a patient with macular degeneration is that they may become legally blind, and that is defined as basically the inability to see the big E on the eye chart with either eye.
Can you see anything now?
No.
How about this big letter?
No.
No?
This may be the best way to illustrate Dr. Katz's definition of macular degeneration. This is what normal driving conditions look like with normal vision, and this is what driving conditions look like with severe macular degeneration.
I had a sharp pain in my eye first, and then there was a whole cloud of little black specks, you know, and it got kind of fuzzy. And then from then on, there was a gray spot right in the middle of everything I looked at, and I couldn't see anything clearly.
The macular degeneration may be very, very mild, meaning they may have only slight difficulty. They may only need a pair of reading glasses or a pair of magnifiers to read the phone book or read the newspaper, and they may have no trouble driving.
The main goal in treating macular degeneration, or any other eye disease for that matter, is early detection. In the most common form of macular degeneration, the dry type, you look to see who is at risk. It has to do with age and, surprisingly, the color of your skin.
This is a condition that exists really only in a lightly skinned population, the white patients who are fair-skinned. This is a disease that does not exist in the black population. So a person who burns easily when they go outside is a person most at risk for getting macular degeneration.
If there is a good chance you'll get it, how do you treat it? First, a look at treatments for the dry type, where the central part of the retina, called the macula, just gets old.
Our major goal in treating the patient with macular degeneration is to keep their vision stable, try to prevent their vision from getting worse.
You can do that by protecting your eyesight outdoors with sunglasses. Eat a good diet consisting of a lot of green leafy vegetables and take your vitamins. Dr. Katz also prescribes antioxidants. And one of the best things you can do for your eyes and your health in general is give up smoking. Most importantly, the use of what is called an Amsler grid. By focusing on the dot in the middle, the patient should make sure that all of the lines on the grid remain straight. If, however, it becomes distorted, blurred, or discolored, you should contact a doctor right away.
The Amsler grid is a home monitoring test that a patient can use to detect any changes in their vision and, most importantly, detect any wet form of macular degeneration.
Wet macular degeneration, the second type and most critical, occurs when abnormal blood vessels from behind the retina grow underneath the retina and they bleed. It is less common, but again, can be more of a problem. You begin to lose your ability to see detail, and things can become blurry.
There is a small spot of blood in the macula in the left eye. I don't see any leakage, I don't see any active bleeding, but as a precautionary measure, I would like to do a fluorescein test. Okay, that's the injection of the dye to make certain that there's nothing going on in the back of that left eye.
That test, the fluorescein angiography, allows the doctor to see the blood vessels in the eye by shooting a dye into the veins. Within seconds, the image then appears on the computer screen. This allows the doctor to be able to see where the blood is coming from. This type of technology with new dyes is now available to patients, whereas, say, 5 years ago, it was not.
Indocyanine green test has probably allowed us to treat approximately 20 to 25% more patients with the wet form of macular degeneration than previously. Okay? It allows us to localize the bleeding more accurately.
What happens if the doctor does find something? We will take a look at an in-office treatment for wet macular degeneration in just a minute. If you have any questions concerning any of the topics discussed on this evening's program, feel free to call the number at the bottom of your screen, 1-800-771-EYES. Representatives of Visual Health and Surgical Center will be there to help answer your questions. The number from Boca Raton to Vero Beach to Okeechobee is toll-free. Coming up on Your Visual Health, treatment techniques that do not require a hospital stay. And later, patients who are going blind and have nowhere to turn haven't met this man yet. You will when Your Visual Health returns.
Find yourself playing hide and seek again with your glasses?
Where are you?
If you're looking for solutions to your eye problems, maybe the answer's not the glasses. Maybe the answer is RK, radiokeratotomy. At Visual Health and Surgical Center, our highly trained staff includes a pair of doctors who specialize in RK. Just think, you may never have to be dependent on glasses or contacts again. We have a dozen locations, making Visual Health and Surgical Center easy to find.
Welcome back to the program. We have been discussing macular degeneration, its symptoms and its treatments. One of the most popular and successful treatments of wet macular degeneration is done right here in the office. It involves the use of lasers.
Okay, now you're going to hear some noise. That's the actual laser going into the eye. Okay, what we're doing is we're shooting the laser to stop the leakage in the back of the eye.
Dr. Katz is using a laser to focus on the leaking blood vessels inside of the eye. The light, when it comes in contact with parts of the retina, heats the problem area, creating a scar that is designed to stop the bleeding. Vision should improve following laser surgery.
And you see this outline right here? That's the scar created by the laser. And that's where the bleeding spot was. All done to save this little area right here, which is responsible for good central vision. But you did very, very, very well. No problems, a lot of pain, a lot of discomfort? Not really?
Just a little bit.
A little discomfort? Okay, that's normal.
Elizabeth Davis had laser surgery and says her vision is nearly back to normal as a result.
Well, first place I got rid of that blind spot that was right there in the middle of my eye all the time. Everything I looked at was that big gray spot. That left immediately. You know, I'm seeing much better. The fact is, I don't have to wear my glasses hardly any.
Not all patients will be this fortunate following the relatively painless procedure. But the hope is vision will improve to the point where patients will see results in just a few short weeks. Macular degeneration is not the only retinal problem keeping us from doing the things we want and love to do. Nearly 1/3 of the problems with the retina are a result of a retinal detachment. This occurs when the retina is pulled away from the back of the eye.
The retina, in order to function properly, needs to be in a special location, a certain location, much like the film in a camera does.
Like macular degeneration, this condition occurs in a person who is approaching their senior years.
As a person gets older, the vitreous, which is the jelly inside the eye, undergoes changes. It becomes less jelly-like and more liquid-like, and it can pull on the retina. The vitreous, when it pulls on the retina, can actually tear the retina. Fluid can then go behind the retina, leading to the retinal detachment.
There are factors other than age that you should be aware of and should look for to find out if you may be at risk.
Well, anybody can get a retinal detachment. However, risk factors to a person having a retinal detachment include being highly nearsighted or myopic, needing thick glasses to see at a distance.
Other risk factors include family history. Dr. Katz points out that if someone in your family has had a detached retina, there's a better than normal chance that you will have one or will get one as well. Also, having a retinal detachment in the other eye or having any type of eye surgery can lead to a retinal detachment. It is also common for trauma to the eye to lead to a retinal detachment, but that is not always the case.
I didn't injure it. I woke up Monday morning 2 weeks ago, and it was there. I didn't injure it or anything, didn't do anything to it. It just woke up and it was, the sight in the bottom third of the eye was gone.
This patient is seeing Dr. Katz for what could turn out to be a retinal detachment. Liquid may be passing through a retinal tear. The patient will also experience a loss of peripheral vision, the opposite of macular degeneration. Aside from complaining about the lower third of his vision getting worse, he is also concerned about seeing spots and flashes of light. This is a common complaint from people who may be at risk.
Sometimes you wonder if the booger not you're going to split the damn.
This patient has just described a floater. If a person sees these floaters, he or she can be examined right away. Although doctors can't treat them, they will check to see if the floaters indicate a more serious problem involving the retina.
If it is a retinal detachment, it has to be fixed quickly because the retina will deteriorate permanently in function if it's not fixed immediately. The right eye has had what's called a vitreous detachment. That is when the vitreous, the jelly inside the eye, has come off the back of the eye. As it comes off, it can pull on the retina ever so slightly and cause those floaters and those flashes of light. Sometimes the vitreous can pull on the retina so hard it can tear the retina.
Let's talk about the treatment for a retinal detachment.
There are many, many different procedures that you can use to repair a retinal detachment. The simplest detachments can be repaired with just laser treatment in the office. A newer technique for repairing a retinal detachment, also done in the office, is a procedure called pneumatic retinopexy. That is a procedure where I inject a gas bubble into the vitreous cavity inside the eye. The gas rises, forces the retina back where it belongs, and and after that, I can fix the tear or hole in the retina that caused the retinal detachment with laser or freezing treatment.
I first came in and the retina was detached. I couldn't see a thing.
This woman had the procedure done and is now in to see Dr. Katz for a follow-up exam. You can see now?
Oh yes, I can see you have a lovely yellow shirt on and everything, but it's still a little foggy. But there is this little purple thing down here, like I say, and I can see through it.
Okay, the purple thing she's looking through now is the gas bubble.
And so I can see through it. It's like transparent.
Right. Okay, that will take another week or so to get better.
All right, we'll come and see you in a couple of weeks.
Another common treatment is called the scleral buckle, a surgical procedure that puts a silicone buckle around the eye. This keeps the eye in place while the tear or detachment can mend. The silicone buckle is left on the eye permanently. Others can be removed in a few days. Every once in a while, a retinal detachment can progress to the point where it becomes so complicated these treatments will not work. In these instances, vitreous surgery is done to reattach the retina to the back of the eye. This is done through a procedure called a vitrectomy. The fluid in the eye, called the vitreous, is removed through a very careful procedure. As Dr. Katz pointed out earlier, through time, the vitreous can harden. The vitreous is then replaced during the operation with another fluid. Occasionally, blood in the vitreous may stop light from passing through the eye to the retina.
There is a small spot of blood in the macula in the left eye.
You may recall this conversation between Dr. Katz and the patient about the discovery of a spot of blood in the patient's eye. Dr. Katz prescribed the fluorescein test so he could get a better look at what's going on inside of the eye.
Okay, we're going to do that right now.
Okay.
Okay?
The fluorescein angiography is prescribed to find the cause of the leakage. This test is very important for patients who suffer from diabetes.
Diabetic retinopathy is the #1 cause of blindness in the working class patient.
When we come back, news for the estimated 100,000 people in our viewing area believed to be affected by diabetes. Diabetic retinopathy is our topic when your Visual Health returns. Stay with us.
When I was little, I dreamt of becoming a dancer, and lucky me, I became one. Then I dreamt of being an actress, and I became that too. What I didn't count on was getting diabetes. Not so lucky. Now, thanks to JDF, the research organization that's funding major efforts toward a cure, we can delay, possibly even prevent the onset of diabetes in some children.
Lucky me.
For a free copy of our research progress report, call the Juvenile Diabetes Foundation at 1-800-JDF-CURE.
Diabetic retinopathy is the #1 cause of blindness in the working class patient. And the fortunate part about this is that it is a completely preventable form of loss of vision.
Diabetes is a condition shared by an estimated 100,000 people in our viewing area. Currently, it is a condition that has no cure. Many people are familiar with the problems associated with diabetes, including heart and kidney disease, stroke, and nerve damage. But many times, the problems diabetes causes on one's vision is often overlooked. Julia Chandler is the president of the local chapter of the Juvenile Diabetes Foundation International.
Diabetes is what they call a hidden disease. You really can't see those complications because you see this wonderful, healthy body, but you don't see the vessels inside that the sugar has destroyed. The little vessels in the kidneys, the little vessels in the eyes, those are the first things that are noted as far as complications. That's the beginning of the complications.
Dr. Katz, who is on the local Juvenile Diabetes Board, agrees early detection of diabetic retinopathy is a priority in treating patients with diabetes.
The fortunate part about this is that it is a completely preventable form of loss of vision. A diabetic needs to be followed on a yearly basis, possibly even more frequently, but there's really no reason for a diabetic ever to lose vision from their retinopathy.
Those exams should be more than just a routine exam.
That's correct, and the only way to do it is to have a dilated fundoscopic examination on a yearly basis. having the eye doctor or having an internist check the fundus or the retina with what's called a direct ophthalmoscope with an undilated pupil is not an adequate test for diabetic retinopathy.
Simply seeing letters on a screen will not reveal any of the symptoms or problems. In fact, in the best case scenario, there shouldn't be any symptoms or problems at all.
In the great majority of situations, it is completely preventable. Yes, I would say in more than 99% of this of patients with proper care and early intervention.
What about the other 1% and the large number of patients who didn't follow the rule that prevention is the best medicine? They'll need to be treated for a number of symptoms.
I'm not like the signs.
Okay.
I have to practically be on top of it to read them.
Many times patients will complain about not seeing right. Some of the symptoms of diabetic retinopathy and other diabetes-related problems include, again, floaters, spider webs, spots, and blurred vision. Many patients suffer from what is called proliferative diabetic retinopathy. Retinal blood vessels close off and large areas of the retina lose their source of nutrition. Patients complain of not being able to see well at night. This can lead to another serious problem.
And if I was able to pick up leakage before it interfered with their vision, I could have stopped their leakage and kept their vision perfect at 20/20. We don't know how to prevent the leakage, but once the leakage occurs, we can stop it before it interferes with their vision.
Earlier in the program, we talked about the use of laser surgery as a successful treatment for patients with wet macular degeneration. Well, the use of the laser here in the office is also very successful in treating patients with diabetic retinopathy. Following surgery, most patients will see improved vision within weeks. There is a second type of diabetic retinopathy. It involves blood in the eye, a vitreous hemorrhage. This is the more serious of the two. Dr. Katz gets a tremendous sense of satisfaction following the successful treatment of all of his patients, including those with diabetes-related eye diseases.
Well, there are a lot of patients who, diabetics who you keep seeing well their whole life, and you allow them to maintain a happy and healthy lifestyle, a normal life.
And I'm very, very fond of Dr. Katz. I think he's a specialist, and he's just done wonders for me.
If you are a diabetic and have any questions, please feel free to call the number located at the bottom of your screen, 1-800-771-EYES. Representatives of Visual Health and Surgical Center are standing by. Coming up on Your Visual Health, the man who beat depression and is now busy helping others get their lives back together. You'll meet him when we come back.
If you're approaching your senior years or are already there, we know you have a lot on your mind, including fixed income, rising insurance rates, and health care. We're Visual Health and Surgical Center, and we'd like to eliminate one of those worries for you, maintaining your good vision. Every Friday afternoon from 2 to 5, we offer free screenings for cataracts and glaucoma. Untreated eye diseases can lead to a loss of independence or even blindness. Stop by for your free screening, or for more information, call 1-800-771-EYES.
I'm central vision blind.
That's the classic definition of macular degeneration. Ed Alexandrovich found out 6 years ago he had it. It started with the little things, some blurred vision, and some very shaky days.
Look, I've fallen over many curbs.
Have you really?
Yeah, really. I've banged myself up. I've had stitches in my head and so forth. But, a few times you learn to be very careful. One of the real problems is crossing the street in traffic.
Being comfortable with this condition is not easy. When Ed first found out about his macular degeneration and what it meant, he slid into a bout of depression, a lonely condition, ironically, shared by many.
I got angry. And I said, look, You know, I've got to be able to solve this. If I solve it for myself, I got to solve it for other people. You don't have to go down to the bottom. Many people do, because they just let go. People give up. They say, oh, well, this is it. So why should I care? Well, you should care.
His depression led him to where he is today. He's the publisher of a quarterly magazine called The Magnifier. 8,000 readers nationwide and a few overseas pick up valuable information on macular degeneration, and more importantly, they get some direction back into their lives.
People that I come in contact with through the foundation, they are totally devastated. They don't know where they're going to go, what they're going to do. You know, life's got to go on, but these people almost give up. I've had people call me who were on the threshold of wanting to do away with life.
His message to those who are reaching out for guidance is this: use the resources you have available to you. He does. He scans his reading with the use of low vision aids. He says reading the paper word by word through the use of a magnifying glass gives him a major headache. His low vision aids include a special scanner and special fonts on his computer. And every once in a while, he'll curl up with a good book on audio tape.
I have always been an avid reader. I'd read on the plane, I'd read in the hotel, you know, wherever I had a chance. And when I could no longer read, this has become a great substitute.
Ed is tickled over the idea of expanding his services to include a page on the internet. And he hasn't lost his focus or his sense of humor. He hopes to have more success doing this job than he did his previous one.
I got a job in a liquor store. For 3 days they fired me because I couldn't read the prices.
Our next program is Saturday night, December 2nd, same time, same channel. Our subject will be glaucoma. I'm Mike Anthony. On behalf of everyone at Visual Health and Surgical Center, thanks for watching this evening, and we'll look for you again in December. Good night.